Hi everyone, welcome to our first live event at Sarum Health Group. My name is Dr. Chet. I'm the GP partner at both the sites of Mill Street Medical Centre and Lark Hill Medical Centre, i.e. Sarum Health Group. On the live Q&A today, we've got Jules, who's our lead nurse partner, Sally, who's our practice manager, and our aim is to go through a few topics with you and then allow you to ask some questions, and hopefully we'll have all the answers for you. So first of all, the main reason why we wanted to run a live Q&A was that during the COVID vaccination process, we felt they were a really good way to publicise and discuss what we're up to within the practices. And we felt it was a very well attended, and therefore we wanted to do one for the surgery and for our patients. So the main topic of conversation which brought us to tonight was one, we wanted to talk to you about our pilot of running Lark Hill Medical Centre with slightly reduced hours. Those hours are that we run a full day on a Monday, a half day on a Tuesday, a half day on a Wednesday, a full day on a Thursday, and a half day on a Friday. However, we also have our afternoon surgeries based at Millstream Surgery already that can accommodate those patients that need to be seen that evening. So ultimately it's worked really, really well. We've not had any negative feedback from patients. We've managed to move the staff around adequately, but more importantly, we were able to increase our level of face-to-face care, and that was purely because we spent more dedicated time in our mornings where we were doing a mixture. These are the doctors doing a mixture of telephones. We just decided that we'd open up those surgeries to face-to-face appointments. So actually, we've actually been delivering more face-to-face appointments, even though we've been reducing our hours. So, and I see there's already a question about sort of negative press, but I think I'll get to that when we get to the question phase. And then what I then wanted to talk to you about was that we wanted to hear your feedback of what you thought about it, hence why we were running today's event. So the live chat is there that you can ask us questions regarding what your thoughts are about it. All right. So the GPs work in that similar fashion with those opening hours. We've got our nurses working in that same fashion in those working hours. Our dispensary, however, is open on our Lark Hill site for our dispensing patients across the whole week, so we could still dispense those medications because to our dispensing patients, which is roughly about 500 patients in total. So if I start the ball rolling with if there's been any questions regarding it, I then want to go into our new recruits of who we've recruited and the number of doctors that we have, because I know that's quite important for a lot of our patients. And then I'm going to pass it over to Jules to then discuss actually how do you make an appointment to see a doctor. So if I go to, there's only one question on there. Given the UK-wide adverse publicity about the lack of face-to-face consultation, what reassurance can you give, triage notwithstanding, that normal service will be resumed as soon as possible, and when might that be? Really good question. We never officially closed to face-to-face consultations, and we have been running face-to-face consultations for the last 18 months of the pandemic. We've actually been delivering a pretty normal level of service, and actually it's been quite fruitful because we've still been seeing patients, we've still been doing your long-term conditions, we've still been doing all your blood tests. So actually we've not reduced, and actually the NHS today published some data locally, which I might see if I can share it. It's very small though. So this is published for our primary care network, which is both practices and is essentially Avon Valley and ourselves, and it's mainly looking at face-to-face appointments. And what you can see is actually our numbers of face-to-face appointments are on the rise. because the demand is there, but also we're meeting that demand by the way that we're working. What is really interesting is actually the people that we're mainly seeing tends to be the much younger population. However, we're not getting as much demand from our older population. So whether that their preference is to be done remotely or whether they're not interacting with us as much. So we want to publicize that we are massively open and we're there for you. So we are definitely back to normal service, but we never really ultimately stopped. So I'm now going to hand over, because I can't see any more questions, I'm now going to hand over to Jules to then talk to you about how to make an appointment with a GP. Over to you, Jules.
Hi, thanks, Chet. Good evening, everyone. This is what I look like without a mask on. So thanks for joining us. And as Chet said, we just wanted to kind of run through how we run the appointment system. And to be honest, the appointment system has not changed throughout COVID because we were running a total triage system to start with. So actually, when COVID hit, we were probably a little bit ahead of the game with it all and already practicing in that manner. So just to talk you through the ways that you can get any kind of appointment with any of the clinicians here. First off to say, if you are booking to see a practice nurse, then that can be booked straight through reception. It doesn't need to go through triage whatsoever. Okay, so you just book that directly with reception. Any appointment request to see a doctor or a nurse practitioner will have to go through a triage process, and we do that to ensure that you're seen by the most appropriate person in the most appropriate time frame. So there's two ways of booking onto triage. You can either phone up and speak to one of the receptionists, and they will take literally a 2-3 word what the idea of the problem is, and they will book you onto our triage list, and then you will get called by one of the clinicians. Or if you've got System 1 online access, you can book yourself onto triage directly. I should also point out it's not always just the advanced nurse practitioners doing triage. The doctors do take calls from the triage list as well. One thing that I would like everybody to be aware of is that when you book online, you book into a time slot on that triage list, and I'm sure everybody books that time slot because it's a convenient time for them to take that call. And also, if you book through reception, you may ask for us to call at a certain time. I can assure you we will try to call you at that time, but I can't guarantee the timings of any of the calls. And that's largely due to the volume of calls and the workload that we're dealing with, but also any emergency or urgent calls that come through on the day will take priority, but we will try and call at that time if we can. Okay, so that's it, you're booked, you're on triage, and one of the clinicians is going to call you back. And what will happen is we will take a brief history from you so that we can ensure that you're, as I said, being seen by the right person in the right kind of time frame for whatever that problem is. You may find that the nurse practitioners or whichever clinician is speaking to you will diagnose and treat your problem by phone, because there are some things that we can do in that time frame and sort the problem out for you there and then. You may find that we book you to a doctor or we will book you to a nurse practitioner. If we feel that it's something that we can see you for, then we will book you to ourselves. We may order some tests prior to any appointment. So we may think that actually, yes, the doctor would be good for you to see, but he will probably want some bloods done. So we'll sort that out first of all. Or we may even go straight ahead and refer you into the hospital for certain conditions or to other professionals as we feel appropriate. So that's what will happen with your triage call, and then you will be booked appropriately, as I said. If you would like to see a particular clinician, or you want to see a doctor, if you make that known to us on the call, we will endeavour to book you to that clinician. Also to say, if this is an ongoing issue that you're not having regular follow-up with, but you have seen a particular clinician going back, we will always endeavour to try and book you back to that clinician so that you have the continuity of care and you're not having to go over the whole history each time that you come in. Any follow-up appointments that the clinician feels that you will need, they will book for you when you are coming to the end of your consultation, so that you don't then have to go back to reception or go back through the whole triage process in order to get the next appointment with them. The final thing I just want to touch on is at times you may have appointments booked for you that you are not aware of, and they are usually telephone appointments, and that may be because we've had some results come in that we need to discuss with you, or we've had some correspondence come in that we need to discuss with you, and we will just go ahead and book an appointment for that clinician to discuss that with you. If, however, we call you and it's a really bad time to take the call, please do let us know. We will call you back. All right, lovely. So I'm going to hand you back to Chet, and have a lovely evening.
Thanks, Jules. So what I wanted to update you on was our GPs. So there's myself, there's Dr. Charlotte, there's Dr. Ola, there's Dr. Oksana, and the person who's come to join us is Dr. Baelish, and who's working 3 days a week from now on. And we have another GP who we've recruited, who would be joining us at the end of September. So then we'll have a full complement of doctors providing your care needs. The essential bits about going through our sort of triage system, what we have definitely found over the last 2 years of running it is that actually we're able to make significant diagnosis a lot quicker, because people are getting the right tests and then seeing the right person, so that a referral can be made to the right clinician going up to the hospital. So it's been fantastic in getting if you've had a change in bowel symptoms, getting all the stool sampling, getting the blood test done, so that when you're seeing the doctor with those problems, we're able to make that referral significantly quicker than previously, when you were coming to see us in 2 weeks' time. We then try and do the test. We then have to wait another 2 weeks. So we're trying to speed up the whole process for you. So hopefully you guys you as patients are finding that service is meeting your needs. What we are massively finding, though, it is significantly busy, and we are endeavouring to make phone contacts with everybody who phoned us up on the day. However, at the moment we are dealing with a large number of hay fever related illnesses, which, because of the hay fever and pollen, and our main advice to you is please go and seek self-help in pharmacies and have a look online, because nearly all the treatments that we're kind of advising you to take, everything can be purchased over the counter. There's very few remedies that we can prescribe that is going to make any significant difference, and therefore, if we could try and help us manage those sort of level of cases, we'd have significantly more time on the patients that are actually needing medical support on the day. So we want to keep adding that voice in. The final thing to add is that I wanted to give everyone a brief update on the COVID vaccinations. We have largely successfully vaccinated the most significant groups while using our Larkhill base, and therefore now all the COVID vaccinations need to go through the national centres and the national number of 119. We have had a few questions about when we're going to be getting the third vaccination. Nothing has yet been penciled in or put in place, but what we were planning to do was to have another live Q&A probably at the end of August, early September, to talk to you when we might have a bit more information, and especially when we're starting our flu drive, which is going to happen roughly the same sort of time, that possibly we may be getting the next set of COVID vaccinations. So I'm going to leave it there, and we're going to leave the chat box open. So if there are any further questions, please don't hesitate in asking us, and then we will do our best to answer them. We'll give it a few more minutes and see if anyone else wants to ask anything. No? Well, look, we are always here to help, so please get in touch with us. We're very accessible, and we'll say goodbye, and we'll send out another message for the sort of August, September time. Thank you for joining.